The problem that the Alliance for Paired Donation faced as we tried to help people with kidney failure was, how could we help more patients find a living donor kidney transplant? The challenge that we faced was that sometimes people are fortunate enough to have somebody who loves them enough that they're willing to give them a kidney, but they're not able to give them a kidney because they face an immunological barrier that prevents their donor from being able to give them a kidney. And so what the Alliance for Paired Donation does is we bring many of these kinds of people together in a large pool and find opportunities where the donor of one pair can give to the patient that needs a kidney in a different pair, and the donor from that pair can then give a kidney back to the other person, or other different kinds of arrangements where people essentially swap their donor's kidney in order to achieve a living donor kidney transplant for themselves. The Alliance for Paired Donation, as we set out to do this, had two things that we wanted to achieve. We wanted to maximize the total number of kidney transplants, and we wanted to maximize the total quality of the transplants that we achieved. We wanted to make the best use of the living donor kidneys that we had and achieve the best result, which in our mind entailed both maximizing quality and quantity. The Alliance for Paired Donation was very fortunate to be approached by Alvin Roth, now a Nobel Prize laureate in economics, who believed that he could help us use operations research to overcome the challenge that we faced of trying to maximize both the number and the quality of transplants that could be achieved. So let me give you a simple example of what it is that Al and his team were able to deliver for the Alliance for Paired Donation. Imagine that you were in a room of 100 people, and each person in the room had somebody outside of the room that wished to give them a kidney. But they could not. They had a barrier that prevented them from giving them a kidney. But all the people outside of the room could give to somebody else in the room, and that would allow many transplants to happen. You could imagine that the people outside of the room some of them might be able to give 10 or 20 people within the room a kidney, but they can obviously only give up one kidney. So out of the 10 or 20 people they could give a kidney to, who should we choose so that the most people in that room get a kidney transplant, and when all is said and done, the kidney transplants last for the maximum amount of time because we made good choices about who we gave those kidneys to. Al and his team have helped us to solve that problem and to find the maximum number of both, the best solution in terms of both the total number of transplants and the best quality transplant. And this type of transplant has really transformed the field of kidney paired donation in the United States and now represents about 80% of the kidney transplants done through this mechanism. What that has done for the United States as a whole is it's not only improved the quality of care for these patients, but it's reduced the cost, because the cost of having a kidney transplant in the United States is much cheaper than the cost for paying for dialysis, and yet transplantation is a much better way to treat patients with kidney failure. Thus, we've achieved through the work of Al Roth and the Alliance for Paired Donation true healthcare reform, in that we've improved the quality of care and reduced its cost. We've also achieved a third aim of healthcare reform, and that's to improve access to care, because many of the patients who are being transplanted by this approach are receiving kidney transplants who would not otherwise have had access to this to a living donor kidney transplant. So we've improved the quality of care and saved millions of dollars for the United States just from the work of the Alliance for Paired Donation. But the impact of the Alliance for Paired Donation's work has had ramifications with other organizations in the United States and around the world that have really helped to reshape the way we're doing kidney paired donation.